The patient is a 13-year-old male with a history of hematuria, hypercalciuria, and kidney stones who presents to the emergency department with his mother. Mom states that she received a text at 7:15 this morning while the patient was on the bus when he suddenly developed kidney stone pain. Mom states that he was not complaining of pain prior to this, and over the last couple hours, his pain has gotten significantly worse, which prompted mother to pick him up from school. He does have a history of kidney stones. His last kidney stone was over 1 year ago. He has been seeing Dr. Kai with nephrology for outpatient follow-up for his hypercalciuria and hematuria. Patient states that he's been unable to urinate today because of pain, but has not seen any hematuria in his urine prior. He denies any nausea and vomiting and points to the suprapubic region on the right side to be painful, and he has denied any fevers. Review of systems: he denies fevers, he does not have any rash, no signs of respiratory distress. He is complaining of the suprapubic pain is where he points. He has not had any nausea or vomiting or diarrhea. He is having difficulty urinating because of pain. No dysuria, no hematuria, no discharge, and no testicular pain. He is not complaining of any back pain associated. He has not had any headache. Past medical history includes hematuria, hypercalciuria, kidney stones, ADHD, and OCD. Surgical history: he's had an adenoidectomy and a metal removed from his eye. He lives with family, and mom and dad also have a history of kidney stones. He takes Vyvanse daily. He does not have any allergies, and his immunizations are up to date. Upon arrival, his vital signs were all within normal limits. He appears in significant pain upon exam, restless, walking throughout the room, screaming and shaking. His skin is nice and warm, no rash. His head is normocephalic and atraumatic. His neck is easily mobile. Pupils are equal, round, and reactive to light. His oral mucosa is moist. He has a regular rate and rhythm with no murmur, and capillary refill is less than 2 seconds in all 4 extremities. Pulses and perfusion are well. His lungs are clear to auscultation. He is not in any distress. His non-labored respirations and breath sounds are equal. He has soft abdomen, normal bowel sounds with no organomegaly. He has significant pain on his right suprapubic area. He has normal genitalia for his age with no tenderness or discharge, no lesions, no hernias, and he has a normal bilateral cremasteric reflex. His back is non-tender to palpation. He has a normal range of motion, normal speech, and he's alert in answering all my questions. So my impression is that this is a 13-year-old male with a history of kidney stones, hypercalciuria, hematuria, ADHD, and OCD, who presents with severe suprapubic pain concerning for nephrolithiasis. My plan is to establish IV access and give him 3.5 milligrams of morphine IV for pain control. If that does not help, we can consider giving Dilaudid. We will give him a 20 ml per kilo bolus of normal saline to promote stone passage. We will obtain a urinalysis and culture to evaluate the kidney stone and possible urinary tract infection. We will obtain a CBC and a CMP to evaluate kidney function and infectious process. And we will obtain a renal ultrasound to evaluate for the presence of any kidney stones.